Hello, I'm Sherry Broussard, and we're at the office of Dr. Sheard, a local dentist of many years who's been on the forefront locally of cosmetic dentistry. With all the reality shows on television lately, we thought it'd be appropriate to have a dentist speak about one of the phases of a makeover, cosmetic dentistry, as it relates to the smile. Welcome to Dr. Sheard.
Thank you, Sherry. But you and I have been friends for a long time, and I'd appreciate it if you just call me Sheard.
Okay, Sheard. Well, let me tell the audience a little bit about you. You are a fellow of the Academy of General Dentistry, a member of the American Academy of Cosmetic Dentistry, a member of the American Dental Association, the Louisiana Dental Association, the Bayou District Dental Association, and a member of the Pierre Fauchard Academy. You also presented to the Alberta Dental Society and presented table clinics with other dentists to the annual sessions of the American Dental Association and the American Association of Orthodontics.
Thank you, Sherry. Sherry, there's one phase of dentistry I really enjoy. It's cosmetic dentistry. Cosmetic dentistry isn't a specialty of dentistry, but it is one that I have a love for because I've seen the way it changes people's lives. It also gives me a chance to use my artistic and creative talents.
What is cosmetic dentistry?
Cosmetic dentistry is a variety of different dental procedures that we use to enhance a person's smile. It can be, to give you a few examples, bonding, bleaching, porcelain veneers, crowns, bridge work, and the like.
How would you come to know that you would like doing cosmetic dentistry?
Back when I did my first cosmetic case, which was in the early 90s, it was a porcelain veneer case where I helped the patient close in the spaces they had. And when I saw how happy it made them and how much joy I got out of doing it, I realized that I had a phase of dentistry that I could truly do and not feel like it was work. I can truly say now that whenever I see patients that I've done cosmetic procedures for, when I see them on back for recalls and stuff, I actually get a rush like I did when I first did it.
Sheard, since we're here to talk about cosmetic dentistry, can you show us a patient that came to see you and how you helped them and what made them look so good?
Let's look at this patient. When I first saw her, this was the most she would smile because she didn't want to show her teeth. This is the same patient. You can see how she has two lower teeth that were broken, which were baby teeth, and she had crowded and crooked teeth also. On the upper, she was chipping her teeth and they were badly stained and out of position. This is what we were able to do for this patient. Isn't that dramatic?
Sure, this is amazing. She definitely has something to smile about now.
We did this by using veneers and crowns on the upper and lower teeth. And let's use this patient to show some of the aspects that make a pretty smile. The first thing I look at and ask myself is how well do the teeth fill the space between the lips when a person smiles. And in looking at a mouth, the first thing I look at is the relationship of the teeth to the lower lip. The lower edges of the upper teeth should follow the upper edge of the lower lip. You can look and compare the red line to the black line and see what I'm describing. When this is not the case, as is shown in this slide, it usually indicates that the person has a problem with his or her bite. Again, you can see the lines drawn.
Is that what gives a person a youthful appearance?
Sherry, that's a great question. Because everyone wants to look great, and many people are having facelifts, facials, and wearing makeup to look younger, and then they smile and it ages them. But to get back to your question, that's part of it, and certainly the smile would not look as good without the teeth following the lower lip. But there are other things that make a person look youthful. The next thing we look at is the position of the edges of the teeth in relation to each other. The two centrals, that is the two teeth in the center of the mouth, should be the longest. The teeth on either side of them should be a little shorter, and the eye teeth should be a little longer than these. And the further back you go in the mouth, the less teeth you should show. We then look at the proportion of the teeth to each other. The two front center teeth should be a little larger than the ones on either side, and the eye teeth should look a little smaller when looking at them from the front.
Is there anything else that can make a difference in the appearance of a smile?
Sure, Sherry. Let's look at another patient. Okay, when we first look at this patient, we can see that. Let's look and see what's right with it. As you see, the two front teeth are longer than the ones on the side of it, and the eye teeth are a little bit longer than those. Also, the outline of the edges of the upper teeth follow the outline of the lip, which gives it a youthful appearance. Now, why don't you help me with this? What do you think? What do you see that would help this smile look better?
The teeth look small and a lot of gums is showing.
That's very good, Sherry. That's right. The teeth should be longer than what they are wide. So as you see here, these teeth look square. And so we were able to, and you were right about the gum tissue showing, she is showing a lot of gum, but we were able to correct this with one procedure. A gum lift, which is where we go in and expose more of the tooth structure. And now you can see how nice the smile looks compared to the way it was before.
Wow, so that's what they call a gum lift. Let's share with the viewers what one of your patients has said following their treatment. Jeff, you saw Dr. Bird improve your smile. What prompted you to have this done?
Well, Sherry, for my wife and I, it was a very calculated decision. You know, we had to consider a lot of factors, and it probably the biggest hindrance might have been our perception of the cost of doing it. But for the last few years, we thought long and hard about it. We considered the potential benefits, socially, of course, professionally, and even health-wise, as far as being able to smile without inhibition. And another factor was not just to do it. We had made that choice, but who would perform the work? And you know, we came to realize that we live in a culture where the old adage says you get what you pay for. Well, unfortunately, that's not always true. But Dr. Bird and his staff came highly recommended to us, and it's one of those rare instances in life where the value that we got for our money far exceeded what we had expected. And we were very happy. I can only tell you it has enhanced our lives, you know, vocationally, in our social lives, and really every aspect. You know, we feel great, and we are just both thrilled with the work that was performed. So there's absolutely no regrets, and again, there's not a lot of business decisions or any kind of decisions that you look back with a 20/20 and say, if only I would have done it this way. But we are 100% satisfied, and we have recommended Dr. Bird and his staff to all our friends. In the several visits that we had, we've never had a poor experience. I mean, we have been very pleased with the professionalism, the courtesy, and the consistency of the services that they've provided.
Tell me, Sheard, is cosmetic dentistry for everyone?
No, Sherry. Some people are happy with their smiles, whether they have crooked, crowded, or stained teeth, and many people are content with having missing teeth. There was a priest named John Powell who was at Loyola University in Chicago. He was a psychotherapist who said, if a person really joyfully accepts himself, nothing can make them unhappy. And I believe that's true for these people. On the other hand, there was a survey done by the American Academy of Cosmetic Dentistry that said 99% of the people surveyed said that a pleasant smile was a great social asset. And in the same survey, 96% of the adults said that a pleasant smile made somebody more appealing to the opposite sex. And 74% of the people surveyed said that a pleasant smile can enhance one's career. Knowing this, you can see how your appearance can make you accept yourself. Everyone's appearance is important, be a housewife, teacher, or professional person. It's important because it makes us feel great about ourselves. Think about how much happier you are when you know you look great and feel great. Don't you feel great when you know you look great?
Yes, I know how I feel when my hair is done and my clothes look nice, and I feel good about myself.
Well, the same thing with a smile. People with poor dental appearance or aesthetics may not have a disease in itself, but the conditions are no less disabling for those that suffer from them. Frustration with dental appearance can lead to routine neglect of regular oral hygiene procedures, as well as their general appearance.
But what can just a smile do?
A perfect smile can help build your self-confidence, make you look more attractive, and increase your self-esteem. Of all the decisions you make in your life, none are more important than the ones you make about yourself. The way you see yourself and the way you think others see you has a great deal to do with how you feel about yourself. That is why cosmetic dentistry is so important and popular today. It's the appearance of the teeth that creates that smile.
Well, sure. Who can benefit from cosmetic dentistry?
Sherry, almost anybody who is not happy with the appearance of their teeth or smile can benefit from cosmetic dentistry. Damaged and missing teeth can be replaced. Chips, cracks, and stains can be eliminated. If you have crooked teeth, crowded teeth, malformed teeth, discolored teeth, spaces between your teeth, teeth that are too long, too short, too small, too big, can all be helped with cosmetic dentistry. And the best part about it is that most of the time this can be completed in either one visit or a few short visits over a reasonable length of time.
Let's hear from another of Dr. Burr's satisfied patients. Dolly, you went to Dr. Burr and came away with a wonderful smile. Would you recommend this to others, and why?
Yes, I would definitely recommend this to someone to do. It's amazing the difference that it's made in my life. It's a big impact. I smile all the time. Family and friends say that I smile more all the time. I've always questioned why I'm so, smiling so much.
How long ago did you have this done?
I had it done, it's probably about a year and a half now. I got married in June of '04.
Congratulations.
And that was really what prompted me to do it. I did some research and found out about Dr. Burr. I had read an article in the Chamber of Commerce.
Wow.
And I decided to go ahead with it. I knew I was going to be taking out kind of pictures for the wedding.
So did you see yourself in your wedding pictures looking different than you had in previous pictures?
Definitely. I have a huge smile in all the pictures in there.
So every time you look at them, it kind of reminds you of the good decision you made?
Yes.
Wow, this is a lot of information. Is there anything you can supply the viewers with?
Sure, Sherry, I'd be glad to. One of the things we'll supply them with is a smile analysis in which they can look at their mouth and see how many of the things we'll be talking about apply to them. We also have a newsletter that we can give them a copy of. That'll go over the different dental procedures that we do, as well as some questions to ask themselves if they are candidates for cosmetic dentistry. And as an added thing for the ladies, we have something called lip tips, which is, to give you an example, hints on putting on lipstick. It's if you have fine lines around your mouth, don't wear real thin lipsticks that would draw up into these lines. And as a final thing, we have a summary of all the procedures we do that show before and afters. That'll give them a good idea of some of the possibilities that are available to them.
Before we go any further, you just mentioned bleaching, cosmetic recontouring, porcelain veneers, bonding, and crowns. Can we get you to show our viewers what these procedures are and any others you'd like to cover?
Great idea, Sherry. We'll start by doing some of the simpler procedures we do, and then we'll go to some of the complex cases where we use a combination of the procedures.
Sherry, let's look at the problem most people are aware of, is the color of their teeth. We can help them most of the time by bleaching. The procedure I use is to do a combination of in-office bleaching with home bleaching. To help my patients have a brighter smile, this is the procedure I follow. First we clean their teeth, then we take a shade, which is the color of their teeth, before we start the bleaching. Our procedure for bleaching is first to have the patient come for a session of bleaching in the office for about an hour. We then give them custom trays to fit their teeth, along with the bleaching solution to use at home for 2 weeks. The patient returns to our office for another session of bleaching for another hour after 2 weeks.
Wow, that's amazing. Such a difference in just 2 weeks.
After bleaching, the teeth will darken some. Whether you bleach or not, you should avoid drinking red wine, tea, and coffee, as using these in excess will discolor your teeth. Our next case shows teeth that are broken. This child broke them while diving in a swimming pool. We were able to do bonding on these two front teeth to restore them the same day this happened. She was very happy and relieved to know that she didn't have to go around with broken teeth.
And down the road, she'll appreciate this later on.
You're right, Sherry. This person had a space between her teeth, and you can see the two front teeth were not even on the edges of the tooth away from the center.
Well, how did you correct this?
Sherry, we did bonding on the two front teeth to close the space, and then we did some cosmetic recontouring on the edges of the teeth to make them prettier.
Understood. Well, what about this patient? It seems that she has multiple problems.
You're right, but if you look at the problem and see what's wrong, we can come up with a favorable result. I think you would agree that she is showing a lot of gum and the teeth look square. Also, you see on the left side, the tooth next to the front tooth sticking out. You can also see that there's a small tooth behind that one. This was actually a baby tooth that the patient had. Also, the color was not too good.
And could you help her?
Yes, I'm happy to say. The first thing we did was to have a gum lift done to expose more of the tooth structure. We then did porcelain veneers to make them whiter and straighter.
Look at that.
This helped this person gain confidence and raised her self-esteem.
Wow.
Let's look at this patient. She had her two front teeth that were protruding and uneven. The teeth on the side of these were back some also, and the eye teeth were very prominent. Also, behind the eye teeth, you couldn't see any teeth. We call this a dead space or black space because the teeth did not fill the space between the lips. There were also old fillings that were discolored, taking away from her appearance.
And how did you correct this?
Well, the first thing we did was we did bleaching on the lower, and after doing that, we did porcelain crowns and veneers. Can you imagine how happy she was not having crooked teeth anymore and getting this result in a few short weeks?
Oh, I sure can.
Okay, let's look at this person, Sheard. This patient also had numerous problems. You can see how the teeth were worn on the patient's right side. You can see the patient's teeth on the right side were shorter and showed more gum tissue than the ones on the left. The patient had a bridge on the left side. The head of the tooth was very small and did not look nice. The right side had missing teeth, and of course the two front teeth had spaces between them.
And that's something you notice right away when you meet a person.
Correct. The treatment on this patient was, first we did a gum lift on the right side to have these teeth look the same as the height of the ones on the left. We then bleached the lower and even the lower front teeth. Then we restored the upper by doing porcelain crowns and bridges to give this patient a much improved smile. And I can tell you this person really smiles a lot now.
Unbelievable. This has to be a self-confidence builder.
Our next patient had numerous problems also. You can see that the teeth did not follow the lower lip. The two front teeth are not even and are worn at an angle. The tooth on the left side is behind the center teeth, and the eye teeth are very prominent. There are crowns on the right side that do not match the rest of the teeth, and you can see that on the left side the teeth are not visible.
I sure see what you're talking about.
This patient's treatment consists of first moving the tooth that was back forward by doing some minor orthodontic treatment.
That's
We
nice.
then did